and I felt a little pressure in my neck. And so it lasted for about 10 minutes. It felt strange.
And I just felt this cold feeling in my chest, like when you're catching a cold or you have bronchitis. And I thought, if I go to bed, I'll feel better. But I got up in the middle of the night and I just couldn't sleep.
And then I went into heart failure a year ago and had a heart attack in May.
I didn't even know I was having a heart attack. I thought I was having indigestion.
I went for my annual physical and my doctor asked, anything different? And I said, yeah.
The emergency room staff, they took a chest x-ray, and then when I came back to the bed, I said, it's feeling worse now.
There was really no rhyme or reason for me to go. There really wasn't. All I felt was this slight pressure right here.
And I'm feeling shortness of breath. He sent me for a stress test. Long story short, they found a blockage.
The nurse said, well, we're going to do another EKG because we have the baseline and let's take this one. As they were doing it, everybody came running in and saying to me, you're having a heart attack right now.
I'm 28 years old, and I know that I don't look like the typical heart disease patient, but I've had 2 open heart surgeries and a heart attack 6 months ago.
And within 24 hours, I had a stent.
And when I got to the hospital this time, they told me I'd had 2 heart attacks.
The symptoms for men of heart attacks are more classic, whereas in my case, it was nothing like what you read in textbooks. No chest pain, no arm numbing, nothing that is typical textbook. And so I had no clue that that's what it was.
So I never expected for a million years that anything like heart disease would come to me. I also was a vegetarian for 25 years. So if you look at my profile, on the surface, it looks like, how did this happen?
I never expected it. I'm not one of the textbook cases for a heart attack. I never smoked. I don't have diabetes. And I just have hereditary family heart disease in my family. But I really don't have any of the high risk factors.
As women, we have a tendency to take care of our families and our parents and everyone else before we consider ourselves.
In cardiac rehab, we learned a lot that women are more likely to not seek medical attention when they are experiencing any kind of symptoms related to heart attack or heart disease. So I myself am guilty of that.
When I went to cardiac rehab, I was so outnumbered by the men, I was shocked. And the reason that there's hardly any women at cardiac rehab is because women don't typically survive because they don't know they're having a heart attack, which is very scary.
Women need to get moving. They need to exercise. They need to join the gym, exercise at home, walk. We take care of our kids and our families. We need to take care of ourselves.
And so we need to go to doctors and check on our blood and check on our sugar and make sure that our cholesterol levels are where they should be.
The medical staff is warm and friendly and caring. If I gotta be anywhere in a hospital, it's being like at home here. This is comfortable for me.
The nurses there were fabulous, couldn't be more helpful, concerned. It was a great experience. And I also knew that was the place I should be.
I was cared for at St. Vincent's. My cardiologist is affiliated with the hospital, and he and the entire team in the emergency department, as well as on the cardiac floor, took amazing care of me. Everyone was extremely considerate, compassionate, of course surprised, being that I'm so young, to have gone through something like that. But I'm glad that I was here and not somewhere else.
It was beyond the call of duty of this nurse to not just put a blanket on me and walk away, but to look me in the eyes and say to me, are you all right? And as she did that, she took my hands, and it helped me to focus, right? With her, she was warm, I calmed down.
So please don't ignore it. Get help and take care of yourself. Women, get your annual physicals.
And so I went and had my annual physical, and that was the beginning of what saved my life.
You don't feel right, you need to get to a doctor, because women present differently for heart attacks. You don't necessarily have to have the pain in the arms, the chest pain. You don't necessarily have to have that.
I could have died. And it took my boyfriend urging me to come to St. Vincent's when I did that most likely saved my life, because it got me the medical attention that I needed before it was too late.
If I had stayed home and just tried to sleep through the night, I probably wouldn't be here today. St. Vincent's saved me body and soul, and because of them and everyone here at St. Vincent's, I was able to see the birth of my third grandchild and enjoy my son's wedding.
I could have died. So I'm saying, if you have symptoms, pay attention. If you don't feel good, get help.
My story doesn't include a heart attack event. Mine was way before any of that happened. I was rescued.
I want to make sure that I make the best of this second chance that I've had, and if just one person hears my story and goes to the hospital if they're not feeling well or just not feeling right, then then my mission is complete.
It's the what ifs and the maybes that can take your life from you.
I love St. Vincent's.
I love St. Vincent's.
This is my hospital.
This is my hospital.
This is my hospital.
This is my hospital.
This is my hospital.